Number one killer. It's the number one reason people are admitted to the hospital. It's the number one reason the government's spending money on health insurance in the hospital, because heart disease is so prevalent. People may feel fine, may look fine, and may drop dead tomorrow. And unless we can figure that out, do something about it, and have a relationship with the patient so that they trust you and say, you're going to need surgery to have something like this put in, even though you feel fine. The common risk factors we all know about, but sometimes it happens to people that don't have risk factors. You know, you can never smoke in your life, you can be normal weight, you can exercise, you can not have a family history, and you still can die of heart disease. So it's important to have screening and to be evaluated in that regard. Chest pain symptoms are something of concern that bring people in, but much more commonly it may be fatigue or shortness of breath or tiredness, or you're not able to keep up with your buddies playing golf, or whatever it is. Something's changed. Racing of your heart, palpitations, dizziness, all those things are now the purview of the cardiologist. So it's important to get to your regular doctor and make sure you get seen by a XiMED cardiologist for one of those issues. Fred Sanford did us a disservice about, I'm having the big one and what's going on my arm, I'm gonna die, because usual heart pain doesn't present that way. It's a tightness or a subtle pain in your chest that may radiate to your arm. It may be a minor problem, and that may be your only warning before you have a heart attack. A heart attack is a narrowing of an artery that can be fixed with an angioplasty or a stent these days to prevent that from happening. So the warning is important to do. And even if you're having a heart attack, it's important to come in. We have a great, what's called a STEMI program for people that are having a heart attack. If you come in from the time you hit the door to the time you're treated and your artery's fixed is usually about an hour, and that's all, from start to finish, and it's fixed, because time is muscle. If you get it treated quickly, that's important. Clearly, it's depressing that heart disease is the number one killer still, but those numbers are improving, partly from the technology, partly from some common sense things. People are taking better care of themselves now than they did a generation ago. Eating better, exercising more. Drugs like the statins to lower cholesterol really do work and do help. And some of the interventions, the stents that the interventional cardiologists do, prevent people from having heart attacks. So heart disease is on the wane. We're living longer, so we're more likely to get heart disease and other issues, so it's still always going to be an issue. But we're doing a lot of good things these days to make the opportunity for people to live longer without heart disease. The defibrillator looks like this, a little bigger than a pacemaker, but it has a pacemaker built in it, and you can think of it as having an ambulance built in it. It's a device that will shock the heart back to normal rhythm if you need it, saves lives. I had somebody just this weekend call me and say, I'm getting shocks from my device, went to the emergency room, the device had saved his life. This is called a Zeo patch. This is just glued onto your chest. We put this on, it records every single heartbeat for 2 weeks. Then you come back and we can look at it and say, well, when you were tired, your heart rate was 37. You need a pacemaker because that's too slow. That's why you're tired all the time. Technology has changed so much since I first got into this field. 25 years ago, defibrillators looked like this, and now they look like this. That's a pretty big improvement. We work for the patients. We don't work for a hospital system. We don't work for an insurance company. We really are focused on providing the best care to patients. And all the high-tech stuff aside, it really comes down to seeing people one-on-one in the office, getting to know them, to talk to them about what options they have. And that's what XiMED's all about.